All right, here we go. So in the circulatory system, you've got the pulmonary circulation, and it carries the blood between the heart and lungs and gas exchange, okay? The systemic circulation carries blood between the heart and the rest of the body. So those are the two things you need to remember is pulmonary kind of carries it from the heart and lungs and does all that exchanging of the good gas and the bad gas. And then the systemic carries the blood between the heart and then it takes it to the rest of the body, okay? An interesting thing about the coronavirus, did I already tell you that? Is that, and I'll just recap that, is that the theory is the coronavirus attacks the iron, or it almost mutates the iron in your body, and it prevents your blood system to carry oxygen, okay? So your body no longer, like your hand, your lungs and everything, is not getting the oxygen it needs because the iron is not, it's not carrying it, okay? So that's why it attacks the respiratory system and the lungs. So the medication's job is to try to fix that kind of, it's not actually a mutation, but I'm using that as a reference, is that to make the iron work the right way to carry the oxygen. So it really attacks that whole iron system. It's kind of weird if you read about it. It's kind of a neat thing to read about how it works. But anyways, that was my little soapbox. All right, let's move on. Okay. The heart is, it's a muscle, right? And it's a double pump and it's located in the thoracic cavity. So it's surrounded by a thin membrane sac, the pericardium, okay? You guys have had anatomy, so you know most of this stuff. I'm just kind of recapping. Okay. The heart wall has 3 layers. You've got the epicardium, which is the outer layer of the heart. You've got the myocardium, which is the thick middle layer of the heart. And then you've got the endocardium, which is the innermost layer of the heart, okay? The 4 chambers of the heart are, of course, the left and right atria and the left and right ventricles. Then you've got some valves going on here. So you've got 4 of them, okay? You've got the tricuspid valve, which separates the right atrium and the right ventricle, separates the left atrium from the left ventricle. You've got the aortic valve, which separates the left ventricle from the aorta. So you've got, you've got four valves. So you've got the tricuspid valve, you've got the pulmonary semilunar valve, you've got the mitral valve, and then you've got the aortic semilunar valve, okay? Let's see here. Contraction of the right ventricle forces the blood out through the pulmonary valve, through the pulmonary trunk and into the left and right pulmonary artery. Returning to the heart via the left and right pulmonary veins. Okay, so artery out, veins in, which are oxygenated blood that enters the left atrium. Okay, so contraction of the left atrium forces the blood through the mitral valve. All right, so when we're talking about blood pressure, remember the systolic, which number is that? Is that the top number or the bottom number? Top number. All right, so the top number is the contraction, and the bottom number, which is the diastole, is the relaxation. Okay. Blood pressure, what do we measure it by the blood pressure cuff, the stigma. Yeah, you know how to say that, right? How many of you guys know how to say that, right? All right.
Oh, no.
Yeah, right. All right, so we give it a ratio. So let's say it's 120/80. Okay, that's what it means when it says ratio. All right, some blood vessels. Arteries and veins have 3 layers that surround the lumen. So you've got an outer layer, a middle layer, and an inner layer. Capillaries have only 1 layer, okay? So remember that the veins and the arteries have 3 and the capillaries only have 1. The arteries, of course, they carry blood away from the heart. They are composed of 3 layers, and they have kind of like a thick muscular wall. So when you're looking for a vein versus an artery, remember, an artery is gonna feel kind of thick and hard, okay? When you're talking about capillaries, this is where gas exchange occurs in the capillaries, okay? So they are the single layer cells. And we do some blood testings in the capillaries. You guys are going to learn a little bit about that too. Veins carry the blood towards the heart. Veins are composed of 3 layers, like we said, and most of our tests that we're going to be doing are on veins, okay? They're closer to the surface. So here's an example of some of the, and we've talked about these already, but these are some of the veins, okay? The cephalic is on the thumb side, so this is this one up here. The median is on the thumb side, but it's down right in here. And then you've got the basic, which is over on this side. Okay. All right. Some major arteries. You've got the aortic arch, the posterior tibula, radial, and ulnar. Some major veins are your carotid. Where's that at? Does anybody remember? And your neck, right? Axillary vein, cephalic, and femoral. Okay. Definitions, we've already talked about that. The systole is the contraction of the heartbeat, and the diastole is the relaxation, and then you know what a blood pressure cuff is. Some diseases, aneurysms, arteriosclerosis, stroke, bacterial infection, congestive heart failure, CAD, which is coronary artery disease. MI is a myocardial infarction, so that's a heart attack, right? Rheumatic heart disease, valvular heart disease, hemorrhoids, and varicose veins. All right. So gas exchange occurs where?
Capillaries.
In capillaries. Okay. Which blood vessel is a single cell thickness? Which one's single? We have 2 that are have 3 layers, and we have 1 that's 1 layer. So what is 1 layer? Do you remember?
Is that the capillaries?
That's the capillaries. So capillaries are 1 layer, and the veins and arteries have 3 different layers. Oh, I just gave the next question. All right, which one is more thick muscle layer lining? Which is when you touch it, it feels harder.
Artery.
Artery. Yep, artery. All right, girls. All right, so blood. Blood is composed of plasma, the liquid portion, and cellular components called the formed elements, okay? An average adult has 5 to 6 liters of blood, so 5 to 6. Let's talk a little bit about plasma. So plasma constitutes for 55% of the volume of blood, okay? It's about 90% water and 10% of things like protein, amino acids, gas, electrolytes, sugars, hormones, lipids, and vitamins. The most significant element of plasma are the albumin and the antibody and the fibrinogen, okay? Plasma also contains components and electrolytes. A plasma sample is collected in a tube containing an anticoagulant, a chemical that keeps the blood from clotting, okay? I think that those cards are going to be real helpful in studying, don't you? Because you already wrote them out, so you had one episode of being near them. So I think that if you keep looking at them, because I do know that coming up on next Friday when we do another quiz, there will be some questions on there about like what do you put in, like, let's, for instance, the gray cap, you know, or which one has this and stuff. So start kind of working on that. Okay. Okay. Serum is plasma without its clotting factors. Okay, so serum is plasma without clotting factors. It's formed when the blood is collected in a glass or plastic tube and is induced to clot. So it's going to clot because you haven't put an anticoagulant in it. The conversion of the fibrin forms strands that trap all the cellular elements. Serum samples are collected in tubes with a top that is one of these colors: orange, royal, blue, red, gold, or tiger speckled, red and gold, okay? Formed elements comprise 45% of blood volume. Of these, 99% are red blood cells, with white blood cells and platelets making up the rest. Okay, let's talk about red blood cells. So it's very important that we know that the red blood cells carry hemoglobin, okay? And it's the iron-containing oxygen transport protein that gives blood its red color. Okay, so here's what I was talking about with the coronavirus, okay? So in your blood, you have red blood cells that carry hemoglobin. And this is filled with all this iron, okay, which normally helps transport the oxygen to our body, okay? The coronavirus prevents that from happening, okay? So it's very, very important that the corona patients who are really sick and have to go to the hospital get even more oxygen than what we would normally prescribe a person to help them live. So that's the studies, that's what they're showing. A lot of it, they didn't catch that in time. Okay. There are 5 million red blood cells in a microliter of whole blood, okay? A single red blood cell remains in peripheral circulation about 120 days before being removed by the liver, bone marrow, or spleen. So it lives for about 120 days. Let's say it lives, okay? White blood cells, so red blood cells carry, they have iron that carry the oxygen, right? White blood cells, on the other hand, protect us. So they're our immunity, right? So they're going to help us protect us from infection. There's about 5,000 to 10,000 white blood cells in the microliter of whole blood. At any time, most white blood cells are not in the blood, but in the peripheral tissues and the lymphatic system. Okay, so the lymphatic system helps protect us from diseases. It's almost like when you get sick, that lymphatic system starts releasing the white blood cells to go attack those germs, okay? White blood cells' life spans vary depending on the type of white blood cell. There's 5 types of them. There's neutrophils, there's eosinophils, basophils, monocytes, and lymphocytes. All right, now let's talk about platelets. Platelets are created in the bone marrow from megakaryocytosis. Every 1 milliliter of blood contains approximately 200,000 platelets, each of which remains in circulation for 9 to 12 days. Hemostasis refers to the process by which the blood vessels are repaired after injury, okay? So there's 4 phases. There's a vascular phase, a platelet phase, a coagulation phase, and a fibrinolysis phase. Broken down, a vascular phase, so what this means is when a blood vessel is injured, okay, so that means when you take blood out of somebody's blood vessel, this is what's going to happen to it to repair. So there's the rupture of the vein or the artery causing immediate vascular spasm, okay? This reduces the vessel diameter and reduces the blood loss. So when you go in there and poke it, the body automatically, after you pull that needle out, starts this process to heal that vein, okay? So what it does is it closes the hole that you just made so that we don't lose all our blood, okay? And that then reduces the amount of blood that we lose. So that's the vascular phase. Then we have the platelet phase, which the platelets become activated and they release something that's called they promote fibrin, and that fibrin goes to that little hole you just made and kind of tries to block it. So it kind of starts building and blocking that hole, okay? So the combination of the vascular phase and the platelet phase is called the primary hemostasis. So that's the primary healing process. So it stopped that bleeding and it's starting to heal that little hole you just stuck on somebody. Coagulation phase is there's a whole bunch of enzymes that come in and result in blood clotting, okay? And it is released by a tissue factor, and plasma coagulation factors contact the materials exposed when the blood vessel is damaged. So again, we're building and repairing that area. And then we are, let's see, how do I break this down for you? A condition which blood clots or abnormally in the circulatory system. Okay, so again, then the last phase is tissue repair. That's pretty much what you need to know about that. Okay, so by your little teeny baby poke that you just did, our body is such a neat machine, and it goes and it attacks it and it repairs that vessel so we don't bleed to death. Okay, unless we have some kind of like disorder like hemophilia, and then that gets a little touchy. All right, so blood disorders. White blood cells, they help with bacterial infection, HIV infection, leukemia, and monoleucosis. Disorders of the immune system include rheumatoid arthritis, systemic lupus, multiple sclerosis, and severe combined immune deficiency, which is SCID. So those are just some blood disorders. Here's some more. Hemostasis, platelets, and clotting. Okay, so hemophilias are people that actually have an inherited disorder, so it's passed down, and they have increased bleeding time. So where your little poke, normally the body would repair that, that would be a little harder in this person because they don't have the right bleeding time and they bleed a lot. Okay, so we have to watch for that. People who have DIC, people who have thrombocytopenia, and then if somebody has a DVT, that's also a disease of the veins and stuff. Okay, red blood cells and hemoglobin. So some people are anemic, so their red blood cells are low. Okay, polycythemia, sickle cell disease is passed down from folks to folks, and then thalassemia is another disorder. All right. All right. Let's go down to red blood cells and hemoglobin. Some normal studies are iron studies, CBCs, vitamin B12, and folate levels to see if they have these disorders. So these are some common, right here, labs that you might be drawing on a person. And we're going to learn more about the normal labs and stuff like that. I want to focus on the white blood cells, the T cell count, anti-HIV antibodies, and Western blot tests. We're going to go through that here in a minute. Okay, so we talked about that. We don't need to go over that. All right, so let's kind of look at that. Tell me again, how many liters of blood does an average adult have?
5 to 6.
5 to 6. Plasma constitutes, do you remember the percentage?
55.
Okay. Another name for a white blood cell is? Leukocyte. Leukocyte, yeah. What is the main function of a leukocyte?
Fight the infection.
It fights infection. Which leukocyte is known as a phagocyte?
Neutrophil.
What is that? Neutrophil? Okay. And which carries, oh, yeah. Platelets remain in circulation for? That's
9 to 12 days.
It's 9 to 12 days. Which carries transports hemoglobin?
Red blood cell.
And what is the inherited disorder marked with increased bleeding times? That's hemophilia. Okay, so an average person has 5 to 6. Plasma constitutes for 55, right? Another name for white blood cells is leukocyte. Leukocytes fight infection. What was this one? Which leukocyte? Okay, so neutrophils is the leukocyte that is also known as a phagocyte. Platelets remain in circulation for 9 to 12 days. Which carries hemoglobin? That was red blood cells, right? And what is the inherited disorder marked with increased bleeding time? That's hemophilia. Make sure you're taking notes on all these things. Okay. especially my yellow stuff, okay? Okay, so the lymphatic system. So the system that goes out and fights all of this bad stuff, okay? It includes your veins and your capillaries and your ducts. It also includes lymph nodes and several organs. So when you've heard people who have had cancer, like breast cancer, not only do they have a mastectomy, but they also have to have like lymph nodes under their underarms taken out because that has tried to fight that cancer, and the cancer actually has spread to the lymph nodes, okay? All right, lymphatic vessels are closed at their distal ends, unlike veins and arteries. So let's talk a little bit about that. The lymphatic system returns tissue fluid to the circulatory system. So if a person has had a mastectomy and had to have her lymph nodes removed under her arms, it's going to be very common now to see that arm. So let's say it's the right underarm that she had her lymph taken out of. You're going to see this right arm really, really swollen because now the lymphatic system is not removing fluid from that arm. Okay, so it gets backed up in the arm, so it's not working well. So you may see somebody with a right arm that's double the size of the other arm because the fluid is staying in there. Okay, all right. In the process screening, it for signs of infection and provides a passageway for lymphocyte patrolling the tissue. So it's the lymph system is like little police cars patrolling the body to find the bad guy. Okay, does that kind of help out a little bit? So think of that. The lymphatic system has these little patrol cars that are going all over the body looking for the bad guys. And once they find them, they try to fight them. Okay, I don't know if that helps, but that's my analogy. Okay. We talked about small lymphatic vessels feed into larger ones, and lymphatic fluid is derived from fluid between the cells. So it's called interstitial fluid. Lymph nodes, like I just talked about, chambers located along the lymphatic vessels. Other areas, there's some in the digestive system, respiratory system, urinary tract system, the spleen and the thymus. Take care of those. The tonsils are particularly large lymph nodes. So those tonsils that some people get taken out are actually lymph nodes, okay? So we've got spleen, thymus, tonsils. They're common in digestive, respiratory, and the urinary tract. Okay. Because they provide passageway for mobile cells, lymphatic vessels provide a route for the spread of cancer. Okay, so that's why I said they're out there patrolling, but the problem is they're kind of this highway, and if a cancer cell jumps on board, it spreads all over through the body. Okay, so that's how if you have cancer, let's say you have uterine cancer, and all of a sudden you've got it in your lungs or your brain. It's because the lymphatic system has grabbed it and spread it through your body. Okay. Let's talk about lymphedema. So lymphedema is an accumulation of this fluid, and it's blocked. So you've seen people with really, really swollen legs. That could be because their lymphatic system isn't working. Okay. Again, like I said, if you've got a mastectomy and they've taken nodes, you're going to see a big arm. That's what that means. Now, on the other hand, some people mix up what lymphedema is compared to lymphoma. Okay, so lymphedema is the accumulation of fluid. Lymphoma, which we talked about early on, is actually like a Hodgkin's disease. It's actually a kind of a cancer. Okay, so it's a little bit different. It's usually a tumor of a lymph gland. I have I have a client right now who has lymphoma in his abdominal area, and it's like this. It's the lymph node becomes huge and enlarged. It becomes a tumor itself. Okay, it's kind of an interesting situation. All right. Non-specific immunity refers to defense against infectious agents independent of the specific chemical markers on their surface. Non-specific immunity includes physical barriers and things like white blood cells. All right.
Yeah.
I know this is boring, Emily. We have to go over it. So let's talk about this. Helper T cells are needed to make antibodies. So just remember that helper T cells are needed to make antibodies. Autoimmunity is an attack by the immune system on the body's own tissue. So if you have an autoimmune disorder or disease, what's happening is your body is actually attacking itself. Okay? So that's what it means. And things like rheumatoid arthritis is an autoimmune disorder. So your body is attacking itself. Lupus is an autoimmune disorder. Myasthenia gravis is an autoimmune, and also MS is an autoimmune. Okay. Allergy is an inappropriately severe immune reaction to otherwise harmless substance. And a severe combined immune deficiency is an inherited disorder marked by a lack of T and B cells. Okay, what have you learned? Let's see. A PCT assists with the diagnosis of HIV infections. Remember that one? That was way up there. That's false, guys. The liver is included in the lymphatic system. What do you think? Do you remember what they were?
Spleen,
Spleen,
lymph node, tonsils, thymus.
thymus, right? Good. All right, what else we got here? So let's go, that's the only ones I want to do. Let me do something real quick here. I'm going to test this out, okay? I'm going to try this poll on this. I wanted to just do it on one of our things today. All right, I'm going to open this up, and you're supposed to be able to answer these, okay? So let's see if it works.
Like click it.
I think you should be able to relaunch this poll. We're clear. Yep. All right. So you should be able to. Do you see it?
Yeah.
All right. Let's see if it works. You guys try to answer. I think there are 4 questions. It worked. You guys got them all right. Perfect. All right. So I wanted to test it out because it doesn't look like we're going to be able to do some other things I was looking into. So that worked. So I might be working on that. That worked.
Can
Okay.
we do Kahoot?
Huh?
Will Kahoot work with it?
Yeah, they don't want me to get into that. They said that they're kind of, well, I might use it for something else. I'm kind of looking into that for something else that I want to do with you girls, but probably not on this. Okay, so let's go to just review real quick the questions at the end. Who wants to read the questions? So it's on page 116.
I will.
All right, go ahead and read a few.
In circulatory system, gas exchanges occurs in the A, capillaries. Which blood vessels are a single cell in the thickness? A, capillaries. Veins and arteries are composed in how many layers? C, 3. A characteristic of arteries is B. They have thick muscle layers lining the lumen. An average adult has blank L of blood. C, 5 to 6. Plasma constitutes blank percent of total blood volume, 55. Another name for white blood cell is a leukemia site. A main function of leukemiocyte is to C. Protect the body against infection. Which leukemiocyte is known as phagocyte? B. Platelets remain in the circulation for B. 9 to 12 days. Which cellular components are responsible for transport of hemoglobin? B. Which laboratory test does not assist in diagnosing HIV infection? C. A PTT. A group of inherited disorder marked by increased bleeding times is known as D. Which organ is not included in lymphatic system? A. Liver. Helper T cells are needed to make B. Antibodies.
Good. Hey, also, girls, make sure that you're not going to directly to the answers at the back of the book and using them and not checking them. I found out when I went to one chapter I did yesterday, I think, let me look at it real quick. I think chapter 14, the question answers back there are all wrong. So don't rely on this reference in the back, because I found that in a couple of the chapters, there would be one or two, but that one was totally wrong. So yeah, I was like, oops, these aren't right. So don't just rely on that. Okay. Any questions about boring chapter 7? All right, let's move on to chapter 10, which we're going to talk about capillary collection. Okay, so just kind of a little narrative of what capillary collection is all about. This is more for your review for certification. It's used for a variety of patients, okay, with compromised or otherwise inaccessible veins. So little babies, older folks who don't really have veins. A lot of times, maybe cancer patients, their veins are very tiny at that point. So you might have to do some capillary stuff with them, okay? A calibrated puncture device delivers a precise, little puncture that avoids contact with any kind of things like the bone or anything like that. So the size and purpose of the sample dictates the collection container used, although micro collection tubes are increasingly used for most collections. The BT test assesses the integrity of primary hemostasis by measuring the time required to stop bleeding. So we'll talk a little bit about that, but I just wanted to kind of go through that. Okay, so on the capillary, let's go ahead and do those questions now. Somebody else want to read?
I can do it.
Okay.
Number 1, capillary collections are performed on A. Capillaries. Number 2, which of the following has a higher value in a capillary sample as opposed to a venous serum sample? D. Hemoglobin. Good candidates for dermal collection include patients who D. A&E only. No, it's all the above.
All the above, yep. So on that, let's just go through that one real quick, because so good candidates are people who have frequent collection, folks who are obese because they are hard to find veins on, and somebody who's really dehydrated. They're also people that you can't get blood very well. Okay, go ahead.
Capillary collection may be appropriate in geriatric patients because B. Their veins tend to be small and fragile.
Correct.
An infant heel warming device should be applied for approximately 3 to 5 minutes.
Yep.
The depth of a heel puncture should not be more than C 2.0 centimeters.
Is that what everybody got?
I got millimeters.
I got millimeters too.
Okay.
Yeah.
So the 2 point.
It's 2 millimeters. Yeah. So B.
All right.
That's what I got.
Which finger is most widely used for capillary collections? C, the ring finger.
Yep.
In performing a dermal puncture, the puncture should be D, on the tip of the finger.
Which number?
The loc
It should be B.
B.
Yeah, B is B. Yeah, 8 is B.
I got medial or lateral.
The location for heel sticks is the A, center of the plantar surface.
I think that's B also.
B.
Medial or lateral borders of the plantar surface. Is that what everybody
What-
got? Is that what you got, Rebecca, too?
I didn't write my answers in
Oh,
the
okay.
book. I have them somewhere else.
What did you get? What did you get, Meredith?
I got B.
Okay.
Which sample is collected first in a capillary collection? B.
I got E.
I got E also. So let me look in the back of that. What shoes is Tim? Let's look at that real quick. So this might be one of those things too that are wrong in the back. And I don't know why, but they are.
Or I just can't read and comprehend.
Now, I don't know about that. All right, so 13. Oh, wait a minute. Never mind. 10. Let's look at 10. 10 is E. No? Okay. All right, there's 3 more.
Which medication does not interfere with the BT test? I can't read my handwriting. D.
D. Yep, all of them interfere. So salicylate, ibuprofen, and aspirin. All of them do.
At what level does the blood pressure cuff remain during a BT test? D, 40.
Yep.
How frequently is the blood wicked during a BT test? Every 30 seconds?
Yes. Yeah.
Sorry, I think my internet's cutting off.
Is it going to cut you off?
No, it was just lagging.
Okay. All right. Let's try this slideshow. All right. All right, girls. So let's talk about capillary collection. It's the most common way to obtain a blood sample. At times, it is impossible or inadvisable to do so. Okay, so that's at most times why we do it. Capillary collection is preferred method for, like I said, newborns and infants, bilirubins on neonatals, newborn screenings, and point of care. See if I can get this thing to move down a little bit. I hate this one. I should get rid of it. I can't quite figure out how to do that. Is children under 2, geriatrics, obese, those at risk with deep venous puncture, those only needing a dermal puncture, patients requiring frequent blood tests, glucose monitoring, and patients with burns or scars. Okay. Venipuncture may be contraindicated with patients with the burns or scars, or people who are at risk for venous thrombosis caused by clots formed in the veins. So, because venipuncture increases the risk of venous thrombosis. Okay. Other patients may be at risk for serious complications associated with deep venipuncture. If they have anemia, hemorrhage, infection, organ or tissue damage, or arterial spasm or cardiac arrest. Is usually, oops, they went backwards. No, it didn't. Okay. Young children have small veins and lower blood volume. So if you go in and you take a large tube of blood out of that infant, that could be very dangerous. Okay. So that's why you would do a capillary. All right, let's try this. So let me move this thing so you can read the top. Good candidates for dermal collection include patients who,
All of the above.
All the above.
all the above, right? Okay, again, I'll move this guy. Let's see, let's get him out of the way. Capillary collection may be appropriate in geriatric patients because
B, their veins tend to be small and fragile.
I believe you might be right. Yep. All right. Capillary puncture collects blood from the capillaries, okay? The arterial proportion in the sample is increased when the collection site is warmed. So you're going to probably warm the site to be able to get better blood flow, okay? If patient needs repeated determinations of potassium, calcium, total protein, hemoglobin, or glucose, you must use the same collection technique each time. So you would have to do it each time, okay? Automatic puncture devices deliver a swift puncture to a predetermined depth, which can be significant advantage at sites where the bone is close to the skin. So it's the most desirable one to do if the bone is, if you've got a really thin person and you're trying to do it and their bones are right there, this would be what you would want to use, this device. All right. Micro collection tubes are made of plastic and are available with a variety of anticoagulants and additives. Capillary tubes are available in plastic and come in a range of sizes, in plain or blue bands, or heparin coated with red, yellow, or green band. Micro hematocrit tubes are small plastic tubes with a volume of about 75 ULs, used infrequently though. Warming devices increase the circulation. Things like just a warm towel or washcloth can be applied to the site. There's also commercial warming packs. The temperature of the device should not exceed 42 Celsius, and it should be applied for 3 to 5 minutes. Okay, 3 to 5 minutes. And what's the answer?
3 to 5 minutes.
Very good. This isn't as much fun as in the classroom when you got the clickers. General considerations. So capillary collection should be performed on warm, healthy skin that does not have a scar or cuts, bruises, or rashes, okay? Bone puncture can lead to osteochondritis, a painful inflammation of the bone or cartilage, or osteomyelitis, a potential serious, sometimes fatal bone infection. So we got to make sure we're not puncturing the bone. All right, so depth. To minimize the risk of inflammation and infection, the lancet should never penetrate more than 3.0 millimeters. For heel puncture, the maximum depth is 2 milliliters because the calcium or heel bone can lie very close to the surface. For a premature baby, the recommended depth is about 0.65 to 0.85 millimeters. Puncture width should not exceed 2.5.
B.
B.
Correct. All right. Capillary collection sites for adults and older children. The best sites are the palmar features of the distal segments of the third, which is the middle, and the fourth, which is the ring finger. Okay. Got that? Capillary collection sites for infants. Dermal puncture is performed in the heel on the medial or lateral borders of the plantar surface. Medial or lateral. Okay. It's on the clicker. There it is. All right, which finger is most likely used for capillary collection?
C.
C? Okay. The location for heel sticks is?
Medial or lateral border.
Yep. Steps for capillary collection. Okay, so here's what you got to do. You got to document requisition, sanitize hands, and put on your gloves. Assemble your equipment, select and clean the site, position and hold the area, make the puncture, dispose of the blade, prepare the collection, or prepare to collect the sample, select the sample, and complete the procedures. After documenting on the requisition that you are performing a capillary collection, sanitize your hands and put on your gloves. Assemble your equipment, select and clean the site, warm the area first if necessary. If the site feels cold, it should be warmed for at least 3 minutes at a temperature of no greater than 42 Celsius. Use 70% alcohol to clean the site. You're going to position and hold the area. Hold the finger or heel very firmly. Grasp the patient's finger with its palmar surface up, holding it between your thumb and index finger. To hold the patient's heel, place your thumb in the arch. Wrap your hand over the top of the foot and place your index finger behind the heel. Puncture the skin slightly lateral to the center of the finger. That is slightly towards the pinky finger, so that the hand can be tilted for easier blood flow in the container. Okay? If you're unable to obtain sufficient blood with the first puncture, the policy of most institutions, you can attempt one more puncture. Make the puncture and dispose of the blade properly. Align the device so that the cut is made across the fingerprint, ridges, or heel bone. Dispose of the used blades immediately in an appropriate collection container. All right, so we've talked. Okay, wipe away the first drop of blood. Very important, girls. You're going to wipe away the first drop of blood with a clean gauze, then contaminating the sample with tissue fluid. Keep the finger in a downward position to help encourage the blood flow. You can alternate applying and releasing firm pressure proximal to the site to increase the flow, but avoid constant massage. This will cut off the flow, cause hemolysis, and introduce tissue fluid. Collect the sample and let's see what this says. Once the blood is flowing freely, position the container for collection. Next, precautions to observe when collecting. Micro collection tubes should be slanted downward. Okay? Tap container lightly to move the blood to the bottom. Be careful not to overfill the container. Order of the draw. In collecting capillary blood, platelet counts, CBCs, and other hematology tests are collected first. Okay? So platelet counts, CBCs, and other hematologies are collected first, then the chemistries. Which sample is or are collected first in a capillary collection?
A.
B.
Okay.
Let's see what it is. A and B only. Complete the procedure. Apply pressure to the puncture site using a clean gauze. Once the bleeding stopped, you can bandage the site for older children and adults. So they say not to bandage younger children because they can actually choke on the Band-Aid. Label the microsample container and place it in a large holder for transfer to the lab. All right, so let's talk about BTs, bleeding times. A bleeding time test measures the length of time required for bleeding to stop after incision is made. To perform a BT test, an automated incision device is used with a depth set at 1 milliliter and length at 5. Normal BT is 2 to 10 minutes and depends somewhat on the device used. Bleeding that does not stop within 15 to 20 minutes means one of two things. Either the patient has a condition that's interfering with normal platelet plug formation, or the test was performed incorrectly. A capillary was scratched, the incision was too deep, the filter paper touched the incision, etc. Okay? So there are also medications that interfere. And we talked about that when we went over the questions, like salicylates, ibuprofen, aspirin. So those are all blood thinners, so they, it'll interfere with the blood from clotting. Also, like, remember that hemophilia? That would be one that would be slower. All right. To do this procedure, you're going to assemble, prepare the patient, you're going to position the arm, apply a blood pressure cuff, and it's kept at 40 mm, okay? Position the device, you're going to make that incision and start the timer. Wick blood away every 30 seconds. So you're going to be kind of cleaning the blood away. Complete the test and attend to the patient. So you're testing to see how long it takes for that person to stop bleeding. So you're timing it. All right, which medication interferes?
Dog.
Dog. That's funny. At what level does the blood pressure cuff remain during a BT test?
40.
40. So dog. Good. All right. We did that one. That was quick. All right, let's go real quick. Yeah, I went quick. Let me see if I can get the other.
Is anyone else having a problem with ants at their house?
I hate ants. Oh,
Stink bug.
hate them.
Oh my gosh, stink bugs are the worst.
Stink bugs are terrible too. Yes, I agree. So this one we're going to talk about is some things that could go wrong. Okay. Let me try this again. All right. So variables that occur before analysis of a specimen. Phlebotomist is most responsible. Okay. Specimen collection accounts for more than half of the errors. Okay. So most of the errors happen even before we get going. Many arise during patient preparation and specimen collection. One of the most important day-to-day and hour-to-hour fluctuation composition of the blood. All right, so the composition of the blood can vary. Let's see what that's all about. Okay, some things that can change the draw or the condition of the blood are age, if they've had alcohol, altitude. So if you go out to like let's say go to Colorado and go up on the mountains and the altitude's high, it will change the composition of your blood. If a person's dehydrated, if they've exercised, if they've fasted or not fasted, you know, that if they're supposed to fast and they didn't, that's of course going to change the result. If the patient's sex, medications, posture, pregnancy, and obesity. So these are going to all interfere. Okay, so locating the patient. If the patient's not in his room, you're going to make every attempt to go find that patient, okay? You're going to check at the nurse's station. If the person's in another department, if the person's in another department and you've got this requisition that says you need to get a stat on this person, you're going to find that person and you're actually going to draw it in that department, okay? So if they're waiting outside x-ray and they need a stat, you're going to do it there. You're not going to wait for them to get to the floor and do it, okay? That's what that all means. Okay, well, what's the answer to this one?
See,
What'd you
See.
say? If it's a stat order, what would you do? And they're not in their room.
Locate the patient and draw on that location.
Exactly. So you wouldn't go to the nurse's station and just leave it on their desk because it's a stat. A stat means get it done now, okay?
that could probably get you in trouble.
Yeah, it would get you in trouble, definitely. Okay, factors that prevent access to the patient. So identifying the patient. Several situations can making IDing that patient difficult. So if it's an emergency requisition, so that the patient may not be labeled yet, might not have his ID base, you know, on like that. So emergency room collections, again, the person may not be ready to, with all the things that you need to check. Orders telephoned into the lab, requisitions picked up at the site. Despite the difficulties these situations may present, the information on the requisition form must always match the patient's ID basis. So this is like an inpatient setting. So everything on that requisition form must match exactly to that patient's ID. So let's make sure we know that. Now, if you come into some patient's room and they're sleeping, you do all your best attempts to try to wake them up gently, okay? Now, if you walk into a patient's room who's unconscious, they're not going to be able to do this. So you're still going to have to draw on an unconscious patient, okay? You'll find these kind of patients, like an ICU and et cetera, in nursing homes. But you do your best to try to wake up patients if they're sleeping gently. Now, you wouldn't want to walk into a patient's room who is not unconscious but is asleep and then go ahead and just start drawing without trying to wake them up, right? That would be awful. Presence of physicians or clergy. So if you walk in the room and the doctor's standing there talking to the patient, you might want to, unless it's a stat order, you're going to try to return at another time, okay? If it is a stat order, you might respectively say to the physician, I've got a stat order. Do you mind if I go ahead and draw this as you're speaking to the patient? Some will probably say okay, and some might be, not so nice. Depends on the person. Okay. If the physician enters while you're preparing to draw, it's not a stat, you can go ahead and leave and let them do his thing. Okay. If there's visitors in the room, you want to greet them just as you would the patient. You want to explain to them that you have to draw some blood and if they would mind to step out. Okay. Most visitors will leave the room for a few minutes. Okay, you come in and the patient is nervous, okay? Doesn't like to be stuck with needles. How are you going to calm them down? So you're going to try to distract them. You're going to try to have some conversation. You might talk about the weather, the news, things like that to kind of calm them down and explain to them what you're doing, okay? Language problems. So maybe the person can't speak English or is hard of hearing, things like that. So you may need to have a translator if the person cannot speak English. If they're hard of hearing, you may have to write things down on a board if there's no way to get them to, if they don't have hearing aids and stuff like that. Now, here's the fun thing that you'll probably come upon. Patient refusal. So you walk in and the patient says, I am not letting you stick me, okay? So if this happens, even after you've explained to them about the procedure and why why it was ordered or that, what doctor ordered or whatever, if the patient refuses, you're going to document that on the request that you're holding, and then you're going to also make sure that the nurse is notified, and that nurse will probably be the one notifying the physician, but we need to make sure that all that happens. So if a patient refuses, you don't force it on them, but you do need to make sure that everybody's notified and that you document it on the requisition form. All right, so you walk in and you look at all of their veins and they're horrible, they're hard, the person might have scars all over them. What are you going to do? Okay. So some people may have IVs in one arm and the other arm looks terrible. At this point, you're going to either contact, like you might have a supervisor in the lab and say, well, how do I do this? Or you may ask the nurse for advice on that one, okay? Some other things that might be in your way, hematomas may be caused by the needle going through the vein. So miss the vein and then the blood's pooling underneath the skin and a hematoma might develop, okay? So you can't, of course, take blood from that hematoma. So you wouldn't leave the needle in there and start drawing out that hematoma because at that point it is not fresh blood per se. Edematous tissue. So the arm may appear swollen because of accumulation of tissue fluid. So this is something we talked about with somebody who has some problems with their lymphatic system. That might not be the arm that you choose. An arm, again, that has burns, scars, or really deep tattoos, this might not be a good area to take blood from. We talked about mastectomies, IVs. So it says blood should not be drawn from an arm if there is an IV device in place. Use the other arm instead, okay? Or you may have to use another site also. Any condition resulting in disruption of skin integrity means that the site should be avoided. So if you've got rashes and lesions, etc., you want to avoid that area because there is an increased risk of infection. All right, conditions that may alter the quality of a specimen or cause harm to the patient during a blood draw include what?
E,
What letter?
elephant.
There you go. Elephant, so all of them. So edematous tissue, mastectomies, hematomas, all may alter the specimen. Okay. Difficulty in finding a vein. So you check the arm, and then you go and you don't see anything. So then you go over and check the other arm. Again, you're having problems. So how do you get the vein to kind of pop out? Massaging gently upward from the wrist to the elbow helps. Have them dangle their arm below their heart, so like off the side of the bed, have them hang it down for a little bit. Have you ever gone on a walk and your hands are so swollen when you're done? Nobody's answering that one. Okay, forget that. Anyways, so yeah, dangling your arm down might help promote increase the size of that vein. Okay. Applying some heat will also help increase the vein coming out a little bit more. Rotate the wrist to increase the prominence of the cephalic vein. So you're just rotating it side to side. All right, how do we do this?
Boy.
Tap the ampubal area with the index and middle finger. Let's see. Nope. So I guess they don't really have you tap anymore. So you want to squeeze the patient's wrist, okay? So like, you know, kind of pumping it like this, squeezing the wrist will help. Applying a cold pack would not be what you would want to do. You would want to actually apply a warm pack. And we would actually want to hang the arm, right? So it's really squeezing the patient's wrist. And here's another way to squeeze the patient's wrist or forearm, okay? So you can actually put on a blood pressure cuff about 3 to 4 inches above the area that you want to draw blood. And this might also help you get that vein pumped up. Okay, now, so you can't find one in the arm. There's absolutely nothing that you can find. The leg and foot are more susceptible to infections and clots. So they're usually not recommended in patients to take blood out, especially for patients with diabetes or on anticoagulant therapy like right? Selection from the leg and foot requires a physician's written permission. If you had to, you can use a wing infusion set on the back of the hand. So was it you, Emily, that was saying that somebody told you never do it on the back of the hand?
Yeah.
And in this situation, you would take that over trying to go on a leg or a foot. So yes, you do sometimes have to take it in the back of the hand. All right, so we're going to use 70% alcohol, methylene, ethyl alcohol, or tincture iodine cannot be used to cleanse the site for a blood alcohol. So when we are testing somebody's blood alcohol, none of these can be used. Because I would imagine that would alter the result if you're using some kind of alcohol substance, right? So it will contaminate blood, causing positive results. So they're going to say that you're going to use a substance called povidone iodine or BLK, okay? Except for a patient under 2, you don't use that at all. I'm hoping we're not doing a blood alcohol on a baby.
Yeah.
But when I'm a psychiatric nurse, so I used to have to get blood on children that were like 4 years old, and they came back positive for drugs. So
Wow.
and it wasn't because they were doing drugs. I'll give you a situation. It was because mommy and daddy wanted to have a party, so they would give their little 4-year-old marijuana to put him to bed.
That's sad.
Very sad. I had a lot of sad experiences. All right. What antiseptic must be used when collecting for a blood alcohol? You guys remember?
It
A.
was C and D. F, frog.
F is right. So you wouldn't use alcohol because it will give a false positive to an alcohol test. So you're going to use the povidone iodine or the BZLK. Let's see if that's right. You say F, right?
Yeah.
Problems associated with tourniquet application. So we talked a little bit about this in one of the other chapters. Chemo concentration is caused by tourniquet being on there longer than 1 minute, or pumping of the fist. It can also be because of occluded veins or sclerosed veins, or long-term IV therapy or dehydration. Okay. Formation of petechiae can happen. A tourniquet applied too tightly, or latex allergy. So you put a latex tourniquet on somebody who's allergic to it, it also could be very dangerous for that person. So we always got to make sure we ask them about that. List 4 things that could cause hemoconcentration. Let's see if we remember what I just said. That's our short-term memory loss.
Literally.
All right, let's go back to it. Let's see. Okay, so hemoconcentration can be caused by tourniquet longer than 1 minute. Okay, pumping of the fist, those veins that are sclerosed or occluded, and long-term IV therapy or dehydration. Okay. All right. So how do we do a wing set? So this is like the wing set that we could use in the hand. Okay. And I do know that you guys will have to learn this one. I saw that on your list. What's that? Oh, somebody asked today, was that you, Emily? Are we going to do blood draws on each other? I don't think so.
Thank gosh.
Back in my day, we had to. All right. Assemble your equipment, position the patient's hand, and apply a tourniquet. Okay. Insert the needle bevel side up, remember? So always that little hole is, when you're putting the needle in, the bevel is always upward. We're going to go at an angle of 10 to 15 degrees for a wing set. You're going to collect the sample. You're going to attend to the patient and dispose of the wing set. All right. What can happen with folks who are getting their blood taken? Well, syncope, which is a medical term for fainting. Before syncope, patient's skin will become cold, damp, and clammy. They'll start having beads of sweat on their forehead or upper lip. Patients may state that they are not feeling well or will stop talking. I see that all the time. Their eyes may start to roll back, or their head can tilt either forward or back. Okay? Fainting is most common with outpatients. Patients lying in bed are less likely to faint. So you're going to see fainting more in an outpatient lab. When a patient is dizzy, provide support to protect the patient. Remove the tourniquet and stop the procedure. Apply a cold compress to the patient's head. If necessary, have the patient place their head between their knees. A lot of times, like when you're at a lab, like a lab core or whatever, an outpatient setting, they'll also have you in a chair that can tilt back and the feet go up higher than the head too. Okay. All right, a PCT is collecting a blood specimen from a patient who states, I'm feeling lightheaded. Which should you take? What procedure should you take?
B.
I'd say A.
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 It is A, yep, A. So when the person starts to say they're faint, you're gonna take the tourniquet off immediately and stop the procedure, right? We would probably not want to put a warm compress. We would want to put a cold compress, right? Okay, so we would put a cool compress on their head. We would stop the procedure, take the tourniquet off, and make sure that if they're standing, they're not going to fall over. Okay. What symptoms might a patient exhibit immediately before they faint?
Boy.
Boy.
Cool, clammy, and damp.
Cool, clammy, and damp. That's right. Seizures. If a patient has a seizure during the procedure, remove the tourniquet and needle immediately and apply pressure to the site. Okay. For nausea or vomiting, when emesis occurs, reassure the patient and make him or her comfortable. It is common for the patient to experience nausea. If the patient is NPO, do not allow food or fluid intake. Encourage the patient to take deep, slow breaths. All right. Patient or PCT is preparing to perform a venipuncture for a patient who is NPO. Patient says, I feel nauseous. What should you do?
D. Dog.
Let's see. Yes, ma'am. All right. Pain. So you get ready to stick the needle in and the person pulls back, okay? So what are we gonna do? To prevent the startle reflex, you're gonna make sure you're explaining very carefully to the patient what you're about to do, how it's gonna feel. You're gonna say, I'm going to go ahead and stick the needle, and it's gonna be a little poke. It feels like a poke, a pinch, or a little sting, okay? So that they're more prepared for that. So, and then if there's a hematoma, when blood oozes from the vein into the surrounding tissue, it causes a hematoma. If this occurs during the procedure, remove the tourniquet and needle immediately and apply pressure to the site. So these are just complications that could occur. Now, you go ahead and you get the needle in and there's a lack of blood flow. So it's caused by a defective tube. So sometimes you have a beautiful blood draw, you stick the tube in and the vacuum is not working in there. So you've done a nice, beautiful blood draw and the tube doesn't work, okay? Or the needle was not put in the right spot. You missed the vein completely. These things can happen and it will happen. Even the best of the best, it happens to, okay? Occasionally, blood will not flow into the tube because the vacuum in the tube has been depleted. This may occur when there's a manufacturer defect, or if you've used an expired tube. Remember, you're always going to watch and look at the expiration because they do lose the vacuum once they're older. Or there could be a fine crack in the tube. Improperly positioned needle. If the tube is not the problem, the needle may not be in the right position for the vein, and you may have to adjust it, okay? That doesn't mean you're gonna go like this, which I've seen happen. You know, you might have to just pull back a little bit or a little bit further. Just a little movement will let that blood start flowing. If the tube is too large for the vein, causes excessive vacuum to pull the vein onto the bevel. So the bevel, remember, is the hole. So if you've used a too big of a vacuum, it's going to pull that vein right on top of it and block it. All right, you might have a collapsed vein. A collapsed vein is caused by too much vacuum on a small vein, caused by too large a needle for the vein, or the plunger. Like if we're doing a syringe, you pull the plunger too fast. When using the tube system, a collapsed vein becomes evident when the tube is pushed onto the needle. Okay, so nothing happens. And also, a lot of people have what's called their vein flow. So you want to make sure that you're with your left, so I'm a right. So with my left hand, I'm anchoring below the site. Make sure you anchor it a little bit more with those rolling veins. Okay? This is all going to come with practice, girls. Okay, collapsed veins can be caused by, give me something.
Missing the vein.
Missing vein.
Going through the vein.
Got rolly veins, we've got too strong of a vacuum, too big of needle, etc. Okay.
A lot of things.
A lot of things. All right. Puncture of the artery produces bright red blood and may cause spurting or pulsing of blood into the tube. So we're wanting a vein, not an artery. An artery feels what? What's the difference between the way the vein feels and the artery feels?
The vein feels spongy.
Okay, and the artery is more
hard.
Okay, so by mistake, you've hit the artery, and what you might get is spurting of bright red blood, okay? Because it has a pulse, remember. So that's another way to find out if you're an artery, is you check to see if there's a pulse in that artery, okay? Failure to collect on the first time. The policy at most institutes say that you can have a second try, but you're of course going to start all over again with a new needle and tube. For second tries, go below the previous site or use the other arm. If unsuccessful, have another phlebotomist try it. Okay? So you don't want to be doing 3 or 4 punctures on that person. So how many venipuncture attempts can a PCT usually take?
Dog.
Dog.
Yep.
Oh,
2. All right. Problems in completing the procedure. Patient's request. Sometimes the patient may ask you for water or change in bed position. Prolonged bleeding. Normally the site should stop bleeding within 5 minutes. In all cases, you must continue to apply pressure until the bleeding has stopped. Inform the nurse if the patient has prolonged bleeding. Okay. All right. We've done all that. So those are the videos. So I'm going to get on here. Let's just get out of share. Hold on a second. Okay. What happens when I get out of this? Hopefully you guys don't go away. Okay. All right, anyways. All right, girls. So let's go over those are the 3 chapters. You guys have any questions on those first? Did we go over the answers? No, we didn't, did we?
If a stat test is ordered and the patient is not in his or her room, you should locate the patient. C.
Yep.
Which laboratory department may require special patient ID?
which number?
2.
I'm working on it. Hold on. B.
It's the blood bank is what I have. Is that what you said, D?
I said D, yeah.
Collapsed veins can be caused by D, dog, all of the above.
Correct.
When an artery is inadvertently stuck during collection, which of the following statements is not true?
A.
Do you want to do it, Meredith? Because I don't have it written down.
Yeah, sure.
That's fine.
I'll read it and you answer it.
Yeah.
Which of the following could be a cause of hemolysis?
Which number you want?
5.
That would be 5.
A.
Reasons for specimen recollection include all of the following except.
Hold on a minute. Number 5, I have C. Which of the following could be cause of hemolysis?
You have C.
Hold on a minute.
Number 6 is C.
Yeah.
That was,
I'm so
she was saying 5.
Yeah, let me check 5 real quick. Again, it could be wrong in the book. Okay, so 5. What did you say, Meredith?
I said A.
Yep, it is A. Yep.
Reasons for specimen recollection include all of the following except
C.
prolonged bleeding after needle withdrawal. To avoid reflux of an anticoagulant, you should do all of the following except
A.
keep the patient's arm elevated above the heart. Conditions that may alter the quality of a specimen or cause harm to the patient during a blood draw include the following.
D.
All of the above. Povidone iodine is not recommended for A, blood alcohol draws. Hemolysis is
D.
destruction of blood cells.
All right, hold on, girls. On 9, I think that's Meredith, do you have C on 9?
Yeah.
Yeah, C, not A.
Straws.
Yeah.
Which test result is not affected by patient position?
Number 11, you mean?
D.
Yes.
Blood alcohol. Hemophostasis
No,
is
it's D. Rebecca, it's D. Enzyme.
on 11.
Mhm.
Enzymes. Lymphostasis is
B.
Mhm.
alteration in the ratio of elements in the blood. To enhance vein prominence, you can
C.
squeeze the patient's wrist.
Mhm.
Hemoconcentration is
B.
Yep. That's it. All right. So that is, so far we have covered a lot of stuff, guys. We have done 1, 2, 3, 4, 8, and 9, which will be your quiz on Monday. We've also now done 7, 10, and 11, which will be your quiz on Friday. Okay.
I'll be home for that.
You'll be home for that?
Yeah.
And then the way it looks like to me is then on week 3, which on that Tuesday, we will do an exam. So we will take all of those chapters and combine it into a test. Okay, so we've got quiz, test, all in a row.
Oh my gosh.
I know, Tuesday, Friday, Tuesday. It's all right, it'll be good. Let's go over what's gonna go happen on Monday, or Tuesday. All right, so I don't care who yells out answers, or we can discuss them, but I'm gonna kind of go through some questions, okay, to think about. All right, a diluted solution of which of the following can be used as a disinfectant against bloodborne pathogens on countertops at spaces, okay? So to clean a countertop in a lab, would we use acid? Would we use a diluted bleach, iodine, or Lysol?
diluted bleach.
Yeah, diluted bleach.
It's bleach, yep. All right, a phlebotomist must ensure that the patient understands and agrees that his or her blood is going to be drawn. What is the name of the process? Is that confidentiality, informed consent, legality, or privacy? Emily, you know what it is. I can see it on your tip. Go ahead.
Informed consent.
Informed consent. That's right. Don't be afraid to do it. That's what we're doing here. Okay. So after you guys get certified, what is the requirement to remain for your certification? You have to take an annual, a yearly phlebotomy course. You have to complete a minimum of 500 sticks every year. You need to participate in continuing education, or you need to take a biannual national certification exam. This is after you're certified.
CEUs, continuing education.
Right.
Yeah, that one.
You need CE.
Education.
Yep. For a phlebotomist, what is the principal occupational risk for infection? Is it infection from airborne disease, infection from droplet, infection from an accidental needle stick, or infection from a splash from a drop specimen tube?
Airborne.
Accidental needle stick.
Needle stick.
Needle.
That's the biggest thing that is your, as a phlebotomist, would be your issue, okay? So most accidents are needle sticks. Okay, so needles and lancets are which type of safety hazard? Biological, electrical, physical, or sharps?
Sharps.
Sharps, very good. Proper hand washing technique includes scrubbing hands together vigorously for at least 5 seconds, 15 seconds, 5 minutes, or scrubbing hands is not necessary.
15.
15 seconds. Okay, sodium, potassium, and chloride are all parts of which panel of tests? Is it electrolyte, immune function, lipid, or liver function?
Electrolyte.
Electrolyte. Okay. What is the most common allergy in the healthcare field? Is it vinyl, nitrile, plastic, or latex?
Latex.
Latex.
Good. What is the single most important means of preventing the spread of infection? Is it wearing gloves, wearing a mask, hand washing, isolation of infectious patients?
Hand washing.
Hand washing. I've lost Meredith.
She left, it said.
Oh, wow. Okay. All right. When donning a gown, mask, respirator, face shield, and gloves, which item should be put on last? Should you put your gloves on, your gown, your mask, or respirator last?
Gloves last.
Gloves last.
She sent a message. It said it kicked me out.
Oh, okay. Let me try to invite her again because she really, especially because she's leaving. Hold on. You're making me tired. There she is. All right.
Hello.
Hello. All right. Here's another one. When removing PPE, what is the last thing one should do? Remove gloves, remove mask, remove gown, wash your hands.
Wash your hands.
Wash your hands, right. So the correct way to do that, I'll just refresh you guys. You put the gowns, take off the gown and glove together. Remember how you roll it off? You do your hand hygiene, goggles, mask, perform hand hygiene. So, all right, which anticoagulant is used most often in collection tubes for hematology studies? Is it citrate, EDTA, heparin, or fluoride?
Peptide?
EDTA.
Yeah, EPTA.
EDTA, right. Meredith, I think you missed a couple. So I don't know if you heard this, but the most common allergy in healthcare is latex.
Okay.
The most single important way to prevent infection is by washing your hands. And when donning a gown, mask, respirator, face shield, and gloves, which item should you put on last? And we said gloves. Okay, that's what you missed.
Okay. My internet just crashed, so.
Okay. All right. So here we go. You entered a patient's room and explained that you need to draw blood, and the patient repeatedly refused. What should you do? A, attempt to draw it anyhow because the physician ordered the test. B, call for another phlebotomist to help you convince the patient. C, take the request form back to the laboratory after you have finished drawing your other patients. Or D, notify the patient's physician according to the institute's written policy.
Notify the physician.
Right, right. So you wouldn't wait and you wouldn't go and draw everybody and then go back to the lab and put your, you want to take care of it now. You're going to call. Which term refers to rapid, severe, life-threatening immune reaction? A, anaphylaxis. B, allergic contact dermatitis. C, irritant contact dermatitis. Or D, sensitivity.
Access.
Anaphylaxis. Yeah, so anaphylaxis shock is rapid, severe, life-threatening immune disorder. Did I lose Meredith again?
Her mic's off.
Okay, there she is. Okay. Which of the following hematology tests measures the blood's capacity to carry oxygen? Is it differential? Is it hemoglobin? Is it MCV? Or is it white blood cells? Carry oxygen, that's your clue.
Repeat the question.
Okay, which of the following hematology tests measures the blood's capacity to carry oxygen? Differential, hemoglobin, MCV, or white blood cells?
Hemoglobin.
Hemoglobin. So hemoglobin carries oxygen. Okay. Here's one of these that you guys, again, kind of need to know your tubes. Which color tube may be used to obtain serum for a laboratory test? Serum, okay? Is it green, gray, lavender, or red?
Green.
Red.
Red. Yes, red can obtain serum. What is the most common antiseptic used in routine venipuncture? Bovidine iodine, bleach, isopropyl alcohol, or chlorhexidine gluconate?
Isopropyl alcohol.
Very good. All right. Except for which one? Do you guys remember? Which test would we not use rubbing alcohol on?
The blood alcohol test.
Very good, because it can do a false positive. Okay. The purpose of a tourniquet is A, to stop bleeding, B, to prevent venous flow out of the arm, C, to increase venous flow through the arm, or D, to shrink the size of the vein.
Less.
So is it to stop bleeding? Is it to prevent venous flow out of the arm, increase venous flow through the arm, or shrink the size of the vein? So I've put a tourniquet on because I want to prevent, it's actually to prevent. So if I increase the venous flow, the blood's going in and out of the arm, right? But if I want to prevent it and pull it down in the bottom part of my arm, so and my vein will grow, I'm going to put the tourniquet on. Okay, so it is to prevent the venous flow out of the arm. You don't want the blood leaving the arm, right? Does that make sense? Okay. What is the most common gauge used for routine venipuncture? 20, 23, 16, or 21?
21.
21. Which of the following indicates the largest size needle? 16, 23, 20, or 21?
16.
16, good. Which is not an anticoagulant? Okay, polymer gel, sodium heparin, sodium citrate, or EDTA?
Polymer gel.
Blood collected in a lavender top tube is used for what test? Is it CBC, fasting blood sugar, fed rate, or chemistry?
CBC.
CBC. How many times may a needle be used before discarding it? Once, 4, 2, or 6?
2.
Once.
4.
How many times may a needle be used? Not how many times can you stick a person?
Once.
Once, right. Okay. Tourniquet should be placed how many inches above the venipuncture site? 1 to 2, 2 to 3, 3 to 4, or 4 to 5?
3 to 4.
3 to 4. During the venipuncture, what? Okay. During the venipuncture procedure, the tourniquet should stay on no longer than 30 seconds, 45 seconds, 1 minute, or 2 minutes?
1 minute.
1 minute. Which vein is the first of choice for venipuncture? Basilic, median cubital, cephalic, or iliac? Somebody say something.
Cephalic.
What do you think?
The medium cubital.
It is the medium cubital. That's right. At what angle should a venipuncture needle penetrate the skin? 10 to 15, 15 to 30, 30 to 40, or 45?
15 to 30.
Yep, 15 to 30 is a normal venipuncture needle, okay? When should the tourniquet be removed from the arm in the venipuncture procedure? A, after the needle is withdrawn. B, as the needle is withdrawn. C, before the needle is withdrawn. And hold on. or the tourniquet should not be removed?
After.
Before.
Okay, so it would be before, and the reason is we don't want that hematoma, right? So before we take that needle out, we take the tourniquet off and then take the needle out. So before the needle is withdrawn. All right, the smaller the gauge, the smaller the gauge number, A, the larger the needle in diameter, the longer the needle, the shorter the needle, or the smaller the needle.
Larger the needle.
Yeah, so the smaller the gauge number, the larger the loop diameter. Yeah. All right, I think this is the last one. Yep. Written information about a chemical, its hazards and procedures for cleanup and first aid are available in which of the following documents? Chemical label, safety data sheet, OSHA regulations, or NFPA diamond-shaped label.
OSHA.
Safety data sheet.
Safety data sheet, so it's called the SDS. Okay. So,
And that's the same thing as the material safety data sheet, right?
right, it's the same, yeah, it used to be called the material safety data sheet, so now they call it the SDS. Okay, so that's pretty much what you guys need to kind of know for Tuesday, okay? On Tuesday, we will regroup. Let me go somewhere here.
Are you uploading this to Blackboard?
I can. You want me to?
Yeah, so I can like watch it.
Okay, let me see here. All right, so anyways, make sure you're looking, I'll look here. On your learning module for next week, it's gonna be a little different. It's not finished either. I'm working on it today and this weekend, so keep checking it that way. But week 2 is gonna start involving you using your Evolve account, okay? So
Yeah.
after you read each chapter, you're actually going to do those questions and submit them. So I'll be able to see that you've actually done it. The computer will tell me that you've logged on and you're doing those questions, and they will submit them. It's not necessarily a quiz, but it is for grade each time you've done one of those, okay? So I think I'm gonna have you doing 7, 10, and 11. You also, and that was due on Tuesday. Then by Friday, you're gonna have 12, 13. 13, are we doing 14, 15? Yeah, you'll have 12 and 13. I'm not done yet with the rest of it, but make sure you're looking at learning modules on your Blackboard. That's important. That's where your assignments are, okay? Just because when you go to that one page that you guys can go to and it tells you what's due and what's not due, if it's not Monday of that week, because after Monday I won't add things, but I can add things up until Sunday on the learning modules because I'm working on it. So make sure you go there. But anyway, so next week on Tuesday, we'll have that quiz on 1, 2, 3, 4, 8, and 9, which we just reviewed. We'll do chapters 12 and 13 on Tuesday, and then we'll review for Friday's quiz, which would be 7, 10, and 11. Okay. All right. Any questions?
No.
All right. And Meredith, you're going to try your hardest to Zoom with us, right, on Tuesday?
Yep.
Okay, because we got a quiz right away. When we open up, we're going to have that quiz that day. All right. Anything else?
If I can't, I'll text Emily and say, call me SAP.
Okay. Are you bringing your computer with you?
Yeah.
Okay. Because I don't know how you can do your test that way. You'll have to be able to get on Blackboard to do your test, right?
Yeah.
All right, girls. All right, I'll go ahead and upload this one.
All right.
See ya.
Bye.
Bye.
Yeah.